Hello, and welcome to the Neonatal Nurse Practitioner webinar for the Vanderbilt University School of Nursing. My name is Dr. Colleen Moss, and today I will be talking to you about Vanderbilt School of Nursing's NNP program and why you should select our program. First, I want to start off by showing you our new School of Nursing building. It opened in 2019. It includes many office spaces and as well as meeting spaces for our students, staff, and faculty to collaborate and work together. It's also LEED certified, which means that it has green renewable sources of energy. So it's a beautiful building that also includes our state-of-the-art high-fidelity simulation lab. And I will be telling you a little bit more about our simulation lab and how we use it in the NNP program later in this talk. Here are the objectives for our webinar today. I'm going to talk about the focus of the NNP program as well as review the program curriculum. I'll discuss the NNP block schedule and also review the NCC certification pass rate for our NNP students. As you can imagine, the focus of our program is to prepare graduates to care for ill and improving neonates, both term and preterm infants, in level 2, 3, and 4 settings. Here are our NNP faculty. We are a small but mighty group of 5. It includes myself, Dr. Moss, as well as Dr. Patty Scott and Dr. Helen Nation. We have Professor Jamie Nelson and Professor Christy Sawyer that round out our group. And together we work to bring you current clinical scenarios and simulation as well as up-to-date lectures. All of us are in active clinical practice as well as teaching roles in the School of Nursing. So let's review some of our programs of study. We have several options for you to choose from. There's a full-time option. There are 2 part-time options. One is the 2-year option and the other is a 3-year option that's only available for current VUMC employees as well as a postmaster certificate. We'll go through each of these in just a few moments. We'll start off with the full-time program of study, and this is seen here are the courses for the fall semester. Students will take a total of 15 credit hours. That includes 5 hours of what's called core courses. The core courses are the advanced pathophysiology and the professional formations class. In addition to those 5 hours, you'll take specialty hours in the NNP specialty for physiology, health assessment, neonatal nursing, birth through age 2, and the first part of pathophysiology and management. I'll go through what each of these courses includes in future slides. In the spring semester, you'll take another 15 hours, and that includes 3 hours of a core course, which is professional formations, as well as the specialty hours that are listed here. The neonatal practicum is the level 2 clinical, and I will also discuss that later in this webinar. And then finally, in the summer semester, you will take 11 credit hours. And 5 of those hours are core courses, which is the professional formations courses, as well as the 6-hour credit for the neonatal preceptorship, and that is your level 3, level 4 clinical rotation. If you're interested in the part-time program of study, the year 1 credits are listed here. And as you can see, in the fall semester, you would take 9 credits. The spring semester is 6 credits, and the summer is 5 credits for year 1. And then in year 2, you would take 6 credits in the fall, 9 credits in the spring, and then 6 credits in the summer. And if you're interested in the postmaster certificate, in the fall semester, the students will take 13 credit hours. And again, that general pathophysiology course is required for all of our MSN students, and that is a 3-hour course. In the spring semester, students will take 12 credit hours. And then finally, in the summer, the students will take 6 credit hours for the neonatal preceptorship, as well as a 2 credit hour for Professional Foundations 5. And Professional Foundations 5 is only for our postmaster's students. The neonatal preceptorship, again, is that level 3, level 4 clinical rotation that we'll talk about in a few moments. As promised, let's talk a little bit more about the courses that we offer here at VUSN. So first is our neonatal health assessment course. This is actually a course that I teach in and love. In this fall course, we go through the proper way to complete a comprehensive neonatal health assessment. You will learn to obtain a history from the mother and also accurately perform the gestational age Ballard exam. And that is what's seen here on the slide. In neonatal physiology, you will learn about embryonic development, genetics, and the initial development and functioning of all body systems. In the neonatal nursing birth through age 2 course, you'll learn about attachment theory along with the developmental needs of infants and children up to 2 years of age. Issues associated with infant behavior, newborn screenings, vaccination, and infant safety are discussed. In pathophysiology and management, it's broken into 2 semesters, both in the fall and spring. You'll, of course, learn about pathophysiology and clinical management of a variety of medical diagnoses seen among the premature and full-term infant population. In the pharmacotherapeutics course, you'll learn about the variety of pharmacologic agents that are used to treat disease processes in NICU. We discuss prescriptive authority as well as the administration of narcotics. In the Introduction to Advanced Procedures course, you will learn how to perform the various procedures performed by NNPs. This can include intubation, umbilical line placement, lumbar puncture, PICC line placement, and others. And we also have this course that takes place in our high-fidelity simulation lab, where you will go through a series of NRP scenarios, and you will be in the role of the NNP. And finally, our neonatal preceptorship and practicum are our 2 clinical courses. The spring has the practicum and the summer course is the preceptorship. And I'll go through the hours about those classes in a few slides. As you can imagine, when you are enrolled in a distance program, communication is key with your faculty. There are many ways that you can communicate with the faculty. We do have web-based conferencing. Currently, we use Zoom, but we are also moving to Microsoft Teams for web-based conferencing. We also have web-based testing, so you do not have to go to a testing center or a different location in order to take your quizzes and exams for our courses. We have a remote proctor that you can complete your exams from the comfort of your own home. You can also communicate with us by telephone or email. The faculty are always willing and available to help support your academic success. Let's talk a little bit about what a schedule would look like for you as a student. So our classes are completed in blocks of time, usually at Vanderbilt, but also we have them via the internet, especially in this time of the pandemic. We have 3 fall blocks. The first block is in August. It is a 7-day block that includes orientation to VUSN, as well as specialty orientation, and also all of the fall classes open during that 7-day window in August. Following that time is a 4-day block in October, and those courses can either be in person or online, but you would treat it just as if you're in person, and you would be at home from the comfort of your home or wherever you'd like to be in order to participate in courses those days. And then finally, we have a 3-day block in November. Our schedule is that students typically, again, come to class during these 3 blocks, but with the pandemic, that has changed, and we will communicate with you about what that would look like. But all of the remaining courses are online for you in our online learning platform, and it's called Brightspace. And you can interact with the modules at your own pace and on your own time, whatever works best for you. And also, you'll complete the health assessment clinical in your home state. In the spring semester, we have 2 blocks. The first one is in January, and it's a 5-day block, followed by a 6-day block in February. That 6-day block is very important because that's when you will come to campus and participate in the high-fidelity simulation lab, as well as work with all of the trainers for the neonatal procedures class. Again, all of the remaining classes will be on Brightspace, and you will complete clinical for the practicum in your home state. And in the summer, you're not required to come to campus. The orientation for the neonatal preceptorship is online. All of our quizzes and discussion boards are on Brightspace for both the fall and spring semesters. In the summer semester, you have essentially completed all of your didactic, so we don't have quizzes or tests during the summer. We do front load our program, which means that, again, a majority of the didactic coursework is completed prior to the beginning of your spring clinical. Students usually finish the last 3 to 4 weeks of their coursework when they begin their clinical rotations in the spring. Many times we're asked about if students can work while going through the program, and I would say that depends. If you're a part-time student, many of our part-time students do continue to work full-time in the fall and spring semesters, but in the summer semester, especially that second year whenever you have the 6-hour credit for the neonatal preceptorship, many of our students work part-time or even PRN during that time just because you have so many clinical hours to complete. And speaking of clinical hours, here is the breakdown for our VUSN clinical hours. There are 70 hours in the fall neonatal health assessment course. And to complete your fall health assessment hours, it's important for you to examine both full-term infants or late preterm infants who are not ill but are growing. And we found that it's sometimes challenging to complete these 70 hours in the newborn nursery, so several of our students work with late preterm infants who are not ill but are growing in like a level 2 nursery. In the spring, you have 210 clinical hours. That includes 196 hours of direct patient care and 8 hours in the newborn follow-up clinic. The additional 14 hours is what's called clinical conferencing, and that's when you will interact directly with your faculty and peers to review case presentations as well as interesting diagnoses. And then in the summer, we have 420 clinical hours, of which 406 are direct patient care, and you will focus on the level 3 to level 4 neonate during these summer clinical hours. Students will again spend 8 hours in the newborn follow-up clinic and then have another 14 hours of the clinical conferencing. You may be wondering, what are the preceptor requirements for NNP students? Well, first we ask that the preceptor is an NNP and has a minimum of 2 years of full-time work experience in the NICU. You will have a primary preceptor, and this person is responsible for coordinating your schedule and assigning you to work with other NNPs when the primary preceptor is off of work. And this primary preceptor will also meet with you and the clinical faculty to complete both midterm and final evaluations. Clinical placement can be a stressful process, but we are here to support you as you are determining your clinical placement. So we have 2 clinical placement categories. The first is called MTA, which stands for Middle Tennessee Area, and that's defined as a 150-mile radius around the Nashville area. OMTA stands for Outside Middle Tennessee Area, and in your application you will indicate whether you are an MTA or an OMTA student. Usually students select the site where they currently work, but if you don't have a site that's available to take NNP students, you sometimes may need to travel outside of your geographic area. At VUSN, we can't guarantee that all of our MTA students will have a clinical placement site within the Middle Tennessee area, but we do our best to place you in your clinical site of choice. So when you begin the clinical placement process, you will select a clinical site, and you also communicate with the site to see if they have an opening and that they're willing to work with you as a student. Following the approval of the site, there is an online My Request form that we will introduce to you and help you walk through so that you can complete all the information needed, such as the name of the site, the address, the contact, and the email. If you are having any difficulty finding a site, we have a clinical placement office that's dedicated to helping our NNP students find and identify a clinical site. And the faculty as well as the clinical placement office will work with you in order to do that. So you're never on your own in order to find your clinical site. But we do ask that you contact us early because it can take several months, sometimes up to 4 months, to create a contract with a clinical site. When you're thinking about choosing your site, we encourage you to find a site that you can complete your fall and spring clinical in the same hospital. And ideally, you can complete all 3 rotations, but we also have students that work in a couple of different sites, so we're happy to support you during that process. But again, we ask you to start the process early and look for a site that currently employs NNPs that you can work with. And you will need to have a copy of your primary preceptor's license in order to upload it into Exact. So in our criteria for acceptance to the NNP program, you must be currently working full-time in a level 3 NICU with a minimum of 2 years of NICU experience. We're also looking for students with a GPA of 3.0 or higher. You'll need references from 2 NNPs as well as a neonatologist. And we also will be looking to see if you have potential clinical sites where you live, as many students are completing their clinical rotations in the hospital where they work. And that's why those recommendations are so important from the NNPs and the neonatologists, because they may be the ones that are going to be supportive of you as you return to school. The interview questions are looking for you to articulate the role of the NNP and a plan for where you want to work after you graduate. Our NNP graduates are eligible to sit for the NCC certification exam and also are ready to work as a novice neonatal nurse practitioner. As promised, here are our NCC pass rates for Vanderbilt compared to the national averages. The national averages are the darker gray bars, and as you can see, VUSN consistently for over 20 years has scored higher than the national average for the pass rate for our NCC exam. I want to thank you again for your time today as you joined me in this webinar, and I look forward to reading your application. If you have any questions about any of the items or material that I reviewed today in the webinar, please contact me at the email here on this slide. Thank you very much.